Counter, not full name, please. Everybody, I'm Aaron. Mario asked me to run a class on like basic first aid, trauma care that you guys might encounter, hopefully never encounter, but might encounter out on the water. We've got two real medical professionals here. Three. Yep. I'm just a guy that's done some trauma care in the military, real world, and he wanted to use real world experience to demonstrate the stuff that you guys may run into. So some of the stuff that I've got that's kind of related to this is a Marine combat instructor of water survival. So it's basically the Marine Corps version of a lifeguard, except it's more of like a lifeguard that teaches you to swim by drowning you a lot and then kind of helping you. Red Cross lifeguard, combat lifesaver, tactical combat casualty care, which these guys are probably way better at me and all that, and then real world trauma. And then for the more free diving related stuff, I've done a level 2. I actually got to go with Doug. It was an awesome time. They don't really want you teaching the medical stuff from their course unless you're an instructor, so I'm not going to speak to that. That's all going to be getting guys breathing again that have had a shallow water blackout or something like that. I strongly recommend, one of the best things I ever did in this sport was take my level 1 and 2 courses. You'll have an awesome time, you'll be really good people, and you'll push yourself to levels that you never thought you could hit in the water. I'm sure you can say the same thing. We'll move through this. Basically, the overview of this, one of the acronyms that we use when we're running up on a casualty in the military is MARCH. We'll go through that. It's basically a way to wrap your head around how do I treat this guy from most important to least important in order to keep him alive in the sometimes as short as 60 seconds I have to stop the bleeding and get the breathing started and get this guy able to send to a higher level of care. One thing I'll talk about though is nothing that we're going to talk about today is actually going to help you unless you do rehearsals and practice at home and take further advanced courses, because we're going to talk about stuff, but I've been in 12 years and I've done 5 live tissue trainers, 7 of those tactical casualty combat care things, and I still don't know half of what I should. We refresh this, so if we do a 12 months of training workup for a deployment, we're refreshing this the whole time. At any time somebody might just toss you a tourniquet and be like, hey, put that on. See you're still good to do it. So I recommend if you guys build a first aid kit for your boat, look at it, know what the stuff does, and buy doubles of everything so you can actually take one of them out of the bag and practice with it on your buddy. But even that isn't enough. I recommend taking a further, a real course. So the stuff that I'm just going to talk about today, which is very, very basic, is a whole week of actual schooling, 8 hours a day, and doing reps. So we're giving you an overview. Really, the idea behind this is, I'm not trying to shock you, but it's more of to tell you what you don't know, that you probably from watching movies, I'm not insulting anybody's intelligence, but from watching TV, you're like, oh, I can deal with that. But in reality, when somebody's got blood shooting 3 feet out of his leg, you're like, holy shit, what do I do? So that's the intent for this. It's not super pretty. I cleaned out and got all the pictures approved by Mario. They're as the limited gore as I possibly could. So no burns and nothing super nasty. But just be advised, everybody, there's going to be a couple pictures of of some blood, and there's an intestine shot. But what we do when we're gutting fish is nothing more nasty than that. And then we're going to talk about building a first aid kit. I'm going to try and break this, run through the PowerPoint quick so that we can actually bust out some of that stuff over there and throw a tourniquet on and throw a pressure dressing on, which really what I see for the general group here, the most important thing is going to be knowing how to stop the bleeding, because that's the priority thing. Before I even get further into it, I'll say that if you're going out on a boat and you don't have at least a basic first aid kit and a radio that can contact people, you're wrong and you should fix that. Because you don't know first aid to help yourself, you know first aid to help your buddy, because it's very unlikely that you're going to be able to apply first aid that's effective to yourself. So if you don't know it, you're hurting the guys on your boat, and some of those guys are typically some of our really good friends. Again, I'm not a certified instructor of any medical treatment, so anything you see here is guidelines. You can't come after me for telling you to put a needle in this way and you're gonna get hook yourself in the heart. And these guys will stop me if I say anything that's totally incorrect, because they've got way more schooling than I do. Okay, so the first thing we'll start with is care under duress. We call this care under fire, but really I kind of like changed most of this from like a combat mindset to what I want you thinking about in the event that you see the first traumatic thing that you've ever seen. So the first thing you need to do is not worry about your buddy. Say he got injured somehow, deter whatever threat it is from hurting me, because I can't help anybody if now him and I are hurt. So that's your first rule. Second rule is going to be directing or expecting the guy that's hurt to get himself away from it if you can't get to him yet, or get the boat to him. You know, if you guys are offshore, move the boat to him as you're telling him to get away from the problem. Don't, you know, if he's sitting there in a pool of burning oil, you know, walk him away from that rather than running headlong into it. And then, you know, one of the biggest, most important things is, and your mind's gonna be racing a million miles an hour, and this is why one of the biggest things in the military, in every branch, is rehearsals, you know, like doing something 1,000 times. If you practice putting a tourniquet on at home, you know, 10 times, you're gonna be a lot better at it when you have to put it on your buddy and, you know, maybe he got bit up by a shark. This is a little bit more real to me today than it was, you know, a week ago when Mario asked me to do this, because I stopped by Merrick spearfishing up in Oceanside the other day, and Josh actually has the kid that got bit up in the last lobster opener. Keen, I think his name is, something like that. Yeah, he's actually working up there with him now. He's an awesome kid, but you know, he got bit up on a shore dive, and he got an injury that, you know, somebody who just knows how to put pressure on something may not have been able to affect. Okay. All right, so, you know, once you've gone through that initial process of making sure that no further injuries happen, your initial treatment is going to be priority, getting that bleeding stopped. But don't forget at the same time that you've probably got another guy in the boat, and as you're doing what you're doing, you can have that guy calling EMS. Because we basically have what we call a golden hour to get casualties out. You know, if that guy is on his way to higher care within an hour, the ratio of him surviving from a very life-threatening injury is substantially higher. So don't waste any time. Obviously, number one is taking care of the guy, but make sure you're thinking, hey, talk to the other people on the boat, talk to somebody else, get comms or get communication with, you know, with Coast Guard, whoever. Let them know that we've got this issue. Everybody on your boat should be able to pull up a GPS coordinate, you know, and figure that out, or at least know where the DSC button is on your graph. Okay, so this is that MARCH acronym broken down. We're going to talk mostly about massive hemorrhaging, very little about airway and respiration, and circulation. Head trauma, hypothermia are way more advanced subjects that really we don't even really need to worry about, because here, like stateside, we should have help be able to get to us in the time that we would be able to affect these things. So massive hemorrhaging. Hemorrhaging is bleeding. You're going to control the life-threatening bleeding. If you were to get hit in the femoral artery, you have somewhere around like 60 to 90 seconds. Okay, I keep like referring to military terms. If you got like a laceration to your femoral artery from a shark tooth, you have like 60 to 90 seconds if it's wide open until you're kaput. You know, we all have somewhere between like 4.5 liters to 5.5 liters. You know, bigger guys, you know, maybe a little bit more, but when you go home, take a 1 liter soda or something, or milk, and pour it on the ground and look at it and be like, okay, that's that much liquid. And when you got somebody on the deck of your boat, it'll help you feel a little bit better knowing that that much liquid can be on the ground, and you can lose about 1 liter to 1.5 liters before you're really even, you know, getting in a bad scenario. So I really recommend doing that. They did it for us as a demo in my first one so that I could see that, like, wow, this made a pool of blood this big. I'm not freaking out that my buddy's gonna die. I'm just gonna focus on what's going on. You know, this blood isn't traumatizing the guy who's trying to help, okay? Because it's, you know, again, it's all cool when we like think about it, we're like, oh, I can do it, but if you don't do the reps, you're not gonna be able to do it. It's that simple. Airway, establish and maintain a patent airway. That's just working on making sure if they had something going with their face that you can get their airway open and able to breathe again. And then respiration, the only thing we're gonna talk about with respiration is like, if we were to get a spear shaft that went through our lungs, sorry, you're not one of my like students or anything. Yeah, but if you had something go through one of your lungs, your chest is like a sealed container. If you open that container up, you're going to have issues with pressure differentials and your lungs actually being able to function where your diaphragm is pulling up and down, trying to make everything work. So we're going to talk about how to close that problem up so that it doesn't get any worse. and at least make it so that guy isn't getting in a worse scenario. So, massive hemorrhaging. It's an arterial or like heavy venous bleed that you're gonna see a lot more blood than you've ever seen in your life coming out of someone. So this could be like shark bite to any of the limbs. Sorry if I'm grossing you guys out over there, but so shark bite to any of the limbs. Maybe somebody like was doing what I've seen somebody do and could not believe it. He had a yellowtail between his legs and he was trying to eat Jimmy and just going like this. So if he missed, like that's not the best idea. I wouldn't recommend doing it that way. There's a lot of better ways to do it. That's not the right one. Or diving in the kelp around here. For you guys that are just starting, if you hear like an airplane sound, it's probably more of a boat. And just make sure you're looking up when you come up, because a lot of these boaters will blast through the kelp, not even realizing what they're doing. Just pleasure boaters out renting something for the weekend. So the treatment for any kind of massive bleeding is going to be direct pressure. It's super obvious. You're just pinning whatever is bleeding against a hard spot in their body. It's going to help stop that bleeding. A lot of the guys that I've worked on, like I didn't have my personal kit on me at the time, and they weren't wearing their kit because nothing happens when it's supposed to, in bad environments. So it was simply like walking up to somebody and just putting pressure on a pressure point that stopped bleeding to their leg. If somebody gets an amputation, we'll actually talk about it a little bit when we do a demonstration of where to press and apply pressure. But you can stop a femoral bleed with 2 fingers just by pressing in the right spot on their leg. Obviously, you're going to be freaking out, so you're going to want to use a bigger part of your body, like a knee or something like that. But direct pressure, if you have absolutely nothing else with you, say you and your buddy go up on a patio, and your buddy gets bit, and you're able to grab him and start pulling him to the boat, and he's bleeding, I could have my buddy, as I'm pulling him, and I'm pulling him and applying pressure. So I'm like hitting his pressure point right now. It probably doesn't feel super comfortable. If I'm pissing you off, sorry, just let me know. So pressure point compression, tourniquet is going to be our next step. I'll show you guys. A tourniquet is basically any device that can constrict blood flow. Basically what it does is it compresses your flesh against a bone in your body. It's all it is. Like basically the key factor in a tourniquet is it has this guy right here, which is called a windlass. So this guy you would put on your arm. They're a little bit difficult to do one-handed, but so you would put on your arm. And you would just you get it pretty tight, you start cranking on this guy, you get it to a point where it's tight to where you no longer have blood flow to your arm, and you stick it in the little contraption right there that grabs it. Tourniquet is going to be the best thing to stop any kind of bleeding to your extremities. So we'll talk about how to use this a little bit later. Your next best thing for areas that are like junctional, your pelvis. A lot of times, so you can put a tourniquet on only so high. If I have something like right in my groin, I'm not going to be able to do anything. So I'm going to have to get material inside their body and then put pressure on top of that material so that the material itself pushes and stops that bleeding. We're going to talk about how to do pressure dressings here in a bit. And basically, when you're looking at it, the type of bleed is going to determine how you're going to do it. If somebody is just, lightly bleeding from their arm and it's nothing more than you've ever seen before, you can just throw a pressure dressing on it and probably hang out if you know that that's not a big deal. But if you just want to stop his bleeding and it's just like, oh, dude, that guy's going to have to get stitches later, but we're not trying to go in, pressure dressing is an easy button. It's anything that you think is like, oh shit, that's when you want to start looking at a tourniquet and putting pressure dressings in conjunction with that tourniquet. So these are various types of tourniquets. By the way, actually, I should tell you guys, so all this stuff, this is out of the military, what they're issuing soft right now, the first aid kits we use. But I looked it up. This is the Soft T tourniquet. This is on Amazon for $30. So it's not like these $200 first aid kits that you see that have 90% Band-Aids are an absolute joke. You can build a kit as good as this for less than $100, and it's actual life-saving stuff. You're not gonna be flipping through Band-Aids trying to put your buddy's leg back on. So this guy is on Amazon for $30-40. Do not buy this one. So I'm sure all the medical folks will say the same. This has a plastic windlass on it. This one's metal. First time I put one of these on somebody was the first time I worked on somebody, and it was what was that damn movie where the dude's head got shot off and went 15 feet up in the air? Three Kings? Like, yeah, Three Kings. Like, it was like they dramatized what the guy remembered. Like, that's how I remember it. You know, I ran up to this dude, blood was 15 feet in the air, threw this tourniquet on, I was all jacked up, so I'm like cranking on it, and I snapped the windlass. So I lost pressure on his leg, and now he's losing more blood, and I used the only tourniquet I had. So whatever you're buying, make sure it has a metal turning device. Okay, that's what you want. This is the one that we've got right now. We might as well pass it around so people can play with it and see what it looks like. Do me a favor, half of the stuff that's on the table is stuff that is like mine issued for work. Half of it we're gonna use. So please nobody walk out of here with anything that I don't give you to take home. All right, so massive hemorrhaging. This was a video, but I basically sending it through email, I had to compress everything. You can see the blood squirts. This is like a light one. I believe that's a shoulder or right above the knee. I'm not even sure. But it's basically a video showing a light arterial bleed. And it's just basically every time the heart beats, it's shooting a little bit of blood out. So if you see bleeding that comes with a pulsing effect, it's definitely something that you need to stop immediately. If it's not just like a continuous ooze. All right, so this I looked up shark bite. So that's a shark bite. It looks, I don't know, potentially somewhere on the leg, like his calf. The big thing with tourniquets that I didn't really talk about yet is when you apply these guys, you want to put them up as high as you possibly can. So it doesn't matter if I'm bleeding really bad from right here, it's still going to go up as high in my armpit as I can. There's multiple reasons for that. They used to say 2 inches, or like this, 3 fingers or 2 inches above the injury. The problem with that is as you start swelling, the tourniquet can start slipping. You've got blood, that's a lubricant. So now this thing's slipping down into the wound and people can't work on the wound without loosening the tourniquet, and then you run into a whole mess of problems. It also allows you to, if you put one tourniquet on and it's still bleeding, you have a lot more room to put more tourniquets on down the arm. So when you apply any tourniquet, get right up. If you're doing it on their leg, get right up in their groin, hike their pants up, take the stuff out of their pockets, get as high as you can, move their manhood away so that you don't really add more pain to the problem, and crank that thing down and secure it. Make sure you secure the flap hanging off of it. The other problem with putting it on a lower part of your arm is you've got 2 bones in your arm and your lower leg. You're not really compressing anything against anything. All you're really doing is risking breaking those bones together by cranking on one of these things. And if I hope somebody volunteers to put this on, or you can put it on me, but you can see how tight they get. So they get super tight and it's not super comfortable.
Hey, how long can you do a tourniquet for before you worry about moving?
So what they tell us as the trauma, like the guys who are on the ground dealing with it, that you're not even worried about that. You don't want, so at our level, like everybody in this room, we don't worry about that. Your buddy, like 10 minutes after that thing's on, you put it on, he's gonna feel fine, he's probably still in shock. 10 minutes later, he's gonna start freaking out, it's gonna hurt, and you're probably gonna have to fight him to keep it on. Because they're super uncomfortable, they're really, really uncomfortable. But I mean, they stay on for hours in surgery.
Yeah, just to go on that, I mean, routinely in surgeries for the operating room, you have a tourniquet on for 2 hours, that's part of the standard of care for minimizing bleeding at the operative site. So certainly 2 hours is totally fine. But like he said, just don't worry about the time, put it high and tight, and freeze it.
Not only that, if you're going numb, that means you're more in shock. If you're feeling the pain, you're not further towards into shock as if you start going more numb. The more numb you get, you're in shock.
It's for like 8 hours at least, and like think about like the cost benefit. Either they're gonna die, or they're gonna
Yeah, so even the general military corpsmen and medics are not allowed to take these off. It's like, so you have to be, so our SARCs, our Special Amphibious Reconnaissance Corpsmen, are like a civilian physician's assistant equivalent. They're allowed to take off a tourniquet with their level of training, and they go to extra few years of schools.
So in my training, tourniquets, they were always very restricted. It's like you can't do it at last resort. And then just recently they said, hey, here's all the tourniquets, and now you guys can do them. Just put them on and don't worry about it. They'll go to the operating room and they'll take care of it. But
So-
if you had medical training, advanced first aid years ago, they told you tourniquets, God.
And that,
Only
that
the last
change,
resort.
that change has come from all the wartime data.
Military
That's come-
stuff.
Yeah, all the military
Yeah.
wartime data where we're putting on a lot of tourniquets, and they're seeing that it's providing a lot of benefit and people aren't losing limbs, and they're able to save limbs. But yeah, that has been a big shift. in
Yeah,
that
so
mentality.
if you got training in the years past, it's all changed. Now they throw tourniquets at you and go, these are your kids, don't be afraid to use them.
Yeah, EMT paramedic, they don't even do direct pressure points. You go direct pressure, straight to tourniquet.
Okay.
So it's, but I know it's military.
Yeah, no, it's the same way for us, direct pressure until we're like, if I'm trying to get somebody out of what we call the X, in an area he got shot at, or he's still probably getting shot at, I'm gonna put pressure on him. You know, first guy I grabbed, I had to like grab his leg as my buddy drugged him out and just keep pressure until we got him out of there. And then we put a tourniquet over behind cover. So that's a really good point. The other benefit to doing a tourniquet first with this method of thinking is that you'll see when you do it, a pressure dressing takes probably twice as long as applying a tourniquet, if not more. Tourniquets are super fast. And, I mean, I just did it one-handed. It's not very easy, but I definitely can't do a pressure dressing on myself one-handed very well. So you can apply them to yourself pretty decently. With tourniquets, I think I have a slide for improvised tourniquets here. Okay, so here we talk about like damage to the leg is rare, arm or leg is rare. If it's on for less than 2 hours, but they stay on longer than that sometimes in surgeries. And it's always better to accept the risk of like causing that guy some muscle atrophy or something like that than have him die. So, you know, it's food for thought. So improvised tourniquets. Anything with a windlass can be a tourniquet. So it's not a tourniquet if I take my belt, wrap it around my arm, and just tighten it, because it's only going to get as tight as I can pull, and a pressure dressing would actually get tighter than that. But if I wrap my belt around my arm, jam the knife in there and start twisting it, and then secure the knife in that position, now it's considered a tourniquet. So you can use anything. I've heard, I haven't seen real life examples, but I have heard about people who were diving out of Mexico, one of their guys got bit, and as they were swimming back to the boat, they had 3 divers in the water, they cut one of their spear gun bands off and made a tourniquet with that. That is very likely probably to work. Depending on the wound, you might need more pressure once you get out of the water, because you know bands are they obviously stretch. That's how we get our guns to work. But that's definitely something we have on our boats that can work. The kind of rule of thumb for when we're using improvised tourniquets is like a minimum of 1 inch. If you've only got like a fucking 3/8 rope and it's going to keep the guy alive, use it. But you're going to cause a lot of damage to everything when you crank down that rope and it starts cutting into stuff and tearing on it. Even a piece of cloth that you fold it up so that the pressure is more spread out is going to be better than like your anchor line that you cut a section of and started cranking on it. Some spear gun rubbers, belts. I don't dive with a tourniquet, obviously, because that would be ridiculous. And these things are not suitable for being out in the elements. So your tourniquet needs to be like in a plastic bag away from salt and out of the sunlight, because they will degrade. Guys were having a lot of issue in Iraq and Afghanistan where they keep them on their shoulders, not in a pouch. They would be getting beat down by 120-degree sun. They went to use it on somebody and the cloth shot, you know, so make sure you're taking care of this stuff. I basically just have a tourniquet and my Afrin, because those are the 2 most important things when I go on other people's boats in a Ziploc, and those are like at the top of whatever bag I take on a boat, and I let the guys know when I'm on their boat, hey, I got a tourniquet right here, because a lot of people don't have them on their boats.
Have you ever used like thin bungee material?
What's that?
Thin bungee material.
So I haven't used it, like I was saying, like I've heard of it being used before, and it's definitely better than nothing.
Right.
If I was in that scenario, swimming the guy back to the boat, I would probably prefer to just apply pressure to him, like kind of put his weight on top of me as I swam him back to the boat and find a pressure point and hold it, and hope that was working. Initially, like right after like a shark bite or something, you're going to be in shock for a second. Your body's going to kind of retract your arteries, and it's not going to bleed out for like immediately. Especially with the fact that we wear super tight wetsuits. So that's something you don't want to take off. Like don't take the wetsuit off, because that's applying some compression to him as well. You know, and if you start having to look for other injuries, leave the wetsuit on that part of the body that's compressing that area. You know, start cutting off the arms and chest to look for other stuff. But yes, spear gun rubbers would work, and I've heard they've been used. But again, I mean, You start cranking on that thing a lot, it's going to get really narrow, and it could start causing like further damage to the guy. But the most important thing is keeping him alive. So you got to make your own decision at that point. So pressure dressings. Pressure dressings. We'll open this guy up because I'm pretty sure that's what this new one is. Okay, I'm not even gonna mess with that. So, pressure dressings, you don't need to buy some fancy pressure dressing when you're building your kit. And I'll have a slide up at the end that shows you like the most important things to have. And one more pack of gauze. So all a pressure dressing is a ball of something that you're gonna put, say he got like a bite right here. So I'm gonna put it up against his brachial artery, and then I'm gonna wrap another bandage around that as tight as I can to secure that and push that ball into his artery. So there's a lot of applications for this. One of the biggest ones was like the last person I worked on had like a bleed right inside their pelvis where the tourniquet wouldn't go high enough and nothing else would work. So I ended up taking like 4 packets of this stuff. This opens up really big. We'll open it up and we start messing with stuff over there. They're like, I don't know how long they are. 4.1 yards. So there's a lot of material compressed into these things so that they fit. You'll take this guy out. You'll tie a little knot in it so that you have something to grab. And gauze is super cheap, so everybody can have this in their kit. And honestly, if you lost your tourniquet, you can, it's not going to be as quick, but you can do a lot with a pressure dressing. You take a little ball, and if I had some kind of wound, like really high, like, did we all see the picture of the guy diving in Mexico? I think it was like early this year or last year that like got bit up here and died, and they put that picture online and pissed everybody off. That would be a scenario where a pressure dressing might have some application. So the guy that I'm talking about had like a double entry hole. They were both about the size of a quarter. I took 4 of these guys and just started stuffing them in. And you'll be really surprised when somebody has a hole in them or something like that, how much you can get in. I just keep stuffing it until it's full. And then some, so that you have like a big old wad of it on top of the skin, because you now have to use that big wad to push down and apply pressure with the wraps. So stuffing it in isn't enough. You need to have a wad on top. And like say I filled him up and it's like super packed in, I could definitely grab another thing of gauze and not have to waste the time to open it up, just freaking stick it on the top and then tighten it up just to be the agent that gives me that pressure. With gauze, they actually make, so you guys have heard of QuikClot, right? They used to make QuikClot. It was like a ceramic, I think kaolin clay-based stuff that when you pour it into a moist area, it gets super hot, it burns, and like cauterizes the wound. Well, they were getting like more trauma from the damage that QuikClot did than like how much it helped. So they came out with this stuff that I have over here, and I'll show you guys later. It looks like gauze, so there's no point in pulling it out. It's called combat gauze. It's a reactive agent that is a hemostatic agent, which means it stops bleeding. It just coagulates the blood, or something you can speak to it better. It stops your bleeding, helps you stop bleeding. It's more effective than just regular gauze. Think of like the Bounty Quicker Picker Upper versus like regular toilet paper, like one ply. So I don't know what that costs.
Is that like the sponge, trauma sponge?
I haven't seen the sponges. We don't use those in our first aid kits. We literally have something that looks very similar to this. It's just gauze, but it's got that hemostatic agent in it. So if I was treating somebody who was a massive bleed, I would use the quick gauze. They call it, it's a QuikClot brand, so they call it QuikClot gauze. I would use that inside their body first. It doesn't get hot, so it's not going to burn them, but it's going to help coagulate the blood. So I'm going to stick that in there. It's going to help the bleeding stop. And then as soon as I run out of it, I'm going to start using regular gauze on top. So you want to use that inside where the bleeding is. It's going to help stop everything up. They have different products. I've got one of them over there. You can ask about it later. It's like basically an applicator. We've been testing them. We just used them in a live tissue thing. We aren't super sold on them. It's basically like a giant turkey baster that you compress like this with a bunch of little mini like hemostatic tampons in it. So you like stick it in the hole and like punch it in, and it shoots these pellets in and they expand. It's super cool in theory, but the one time or the 2 times that I've used them, I lost a bunch of them all over the place. Guys were trying to pick them out when they were doing the prolonged field care. And they were more of a pain than just putting gauze, just stuffing it inside someone's mouth. The other thing is with one of those type of like internal deals, like a pelvis or an armpit. So I'll talk about. I didn't ask him permission, but he told me the story. So if he's upset about it, the guy that got bit by the shark last year, he was telling me he went down, he got grabbed, shaken around for about 3 seconds, and he came up and he like didn't feel any pain. So he looked at his buddy and he's like, "Hey, am I okay?" And his buddy's like, "No, dude, your arm's hanging off." And I guess his arm was just holding on by the skin. So he's lucky he didn't bleed out because nobody had any trauma experience as he had to swim back to the shore himself, raise his heart rate even more. He's very lucky he did. He's a 14-year-old skinny kid, so like not a lot going on there. But his buddy could have simply looked in his shoulder and found where the bleeding was coming from and just done that. Like it's so easy. There's not a whole lot of pressure in these veins, and I'm telling you, like you can put your finger on an artery if you can feel the artery and stop it. So direct pressure is the most important to get the guy to where you can do higher care. So the most important thing we could take away from this is if you see bleeding, like put your hand on it until it stops. Poke around, put your finger in there, find where it's coming from and pinch it down. Because you could sit there for 2 hours and wait for EMS with your finger on that. And you get super tired, but if you have to do that, work your other hand in there, don't release your first hand, and just keep pressure. Just alternate between which arm you're giving pressure with. You could keep somebody alive with no other, aids if you had to, just by applying pressure. I don't want to take too long on the talking portion. I'd rather demonstrate stuff. So, is there any more questions on pressure dressings? I know I didn't demonstrate them yet.
For like a spear wound, I guess would be one of the more common ones. Would the best thing be to leave it alone, leave it in there, not take it out?
Yeah, so we're going to get into that one in a minute. So if I don't answer everything you're asking about, just hit me up after we talk about those. Direct pressure, we already talked about. One thing I didn't talk about that I need to mention is if you're moving that guy, like every time you move him, like maybe from the back swim platform on the boat, now you're bringing him in the boat because it's going to be 30 minutes until you get evac. Every time you move him, you need to reassess the tourniquets and any kind of pressure dressings you put on him and make sure they didn't get loose and he started bleeding again. Because one of the problems with pressure dressings is like there's a lot of gauze. And this stuff is super absorbent. So if it got loose and it started bleeding again, you're not going to notice it until it soaks all the way through. So you need to make sure, and you can check that by checking his pulses in his wrist. If I'm trying to stop the bleeding to this arm, I need to shut the pulse off to this wrist. So you can check your tourniquet's effectiveness by checking the pulse in his wrist. All right, so after I just came up to a guy that got bit by a shark, I know his leg is missing.